This video shows the method of surgical implantation of HiRes Ultra with high-focus Slim J electrode. Using the BTE template, mark the location on the skin where the back edge of the BTE package will be. This will be used as a guide during the initial phases of location and creation of the incision. Ensure implant will not be under the BTE template. Use the coil gauge or silicone mock-up to locate the edge of the titanium case. The implant should be placed on a flat and smooth surface. Usually, the device is placed between 45 degrees and 60 degrees to the temporal line. The length of the incision line will be determined by the surgeon and may range from a 4 to 6 cm to a 15 cm conventional post-auricular incision. Separate the skin muscle flap from periosteo layer to provide additional protection for the implant. Maintain a skin flap thickness of approximately 5 mm. The flap should not exceed 7 mm to ensure adequate magnet retention. Modification of the skin flap thickness is at the discretion of the surgeon. Identify the anatomical landmarks to determine the location of the modified cortical mastoidectomy. A modified cortical mastoidectomy is performed. The mastoid bone is excavated until an entrance can be made into the middle ear behind the posterior canal wall at the site of the facial recess. The edges of the mastoid cavity should not be saucerized. Bony overhangs are left superiorly, posteriorly, and inferiorly to aid in retention of the coiled electrode lead. Exposure of the middle ear through the facial recess should allow visualization of the round window for removal of the bony overhang of the round window niche. The surgeon might also decide to perform an extended round window or cochleostomy approach. Measure out the length of the silicone mock-up to gauge depth of periosteal pocket. The device is placed between 45 degrees and 60 degrees to the temporal line. Use silicone mock-up to locate ultra implant position. Verify depth of the periosteal pocket is sufficient by using the ultra silicone mock-up. Mark the length of the anterior edge. If using the silicone mock-up, mark the outer shape of the electrode fantail exit toward the mastoidectomy and electrode lead channel. Anterior edge of implant mock-up should measure approximately 3.5 cm from posterior canal wall to allow for BTE use. Remove the mock-up. Verifying the depth of the periosteal pocket is also sufficient by using the ultra coil gauge. Mark the length of the anterior edge. If using the coil gauge, mark the position of the electrode fantail exit indicated by the notch at the anterior edge of the coil gauge. Anterior edge of implant coil gauge should measure approximately 3.5 cm from posterior canal wall to allow for BTE use. Remove the coil gauge. Use the ultra recess gauge to identify placement of recessed ramp. A 1 mm ramped recess for the titanium case should be drilled in order to stabilize and protect the implanted device. Use the ultra recess gauge to confirm recess ramp depth of 1 mm at the anterior edge. The ramp recess should be at least 1 mm thick in order to create a ridge at the anterior edge. Identify the gray area of the ultra recess gauge for proper location of the electrode fantail exit. To secure and protect the electrode fantail and electrode lead as it exits the implant, a channel or groove should be created between the implant and the mastoid cavity. Continue drilling channel to mastoidectomy to protect electrode lead. The optional use of sutures to bone can provide additional fixation for the implant. After seating the implant in its ramped recess, the device should be secured with non-absorbable sutures to bone. Please be cautious. The suture shall not be placed directly over the fantail portion of the electrode lead. Place sutures into position before placing the implant into the ramped recess. The implant and fantail must be fit securely within the ramped recess. The sutures are placed across the titanium case portion of the implant. Pull any suture knots off to the side of the implant to avoid skin flap irritation. Make sure the electrode fantail is fitted securely within the ramp recess and channel previously created. The high-focus Slim J array can be inserted through a round window, a modified extended round window approach, or conventional cochleostomy. An opening of a minimum of 0.8 millimeters is required. The high-focus Slim J electrode consists of an electrode lead and high-focus Slim J electrode array. The array consists of 16 planar contacts arranged along the medial surface of the electrode array. There is one blue marker on the electrode array, positioned proximal to the 16th contact. The wing refers to the jog at the proximal end of the electrode array at the transition to the electrode lead. It is intended to offer a section of the lead for forceps use to allow insertion of the array. The high-focus electrode forceps can be used to grasp the high-focus Slim J electrode array at the wing proximal from the blue marker. Note, as a safety feature, the tips of the forceps release the electrode if grasped too hard in order to avoid electrode damage. Ensure that the electrode contacts face superiorly toward the medialus. It is essential that the electrode contacts are positioned correctly in relation to the medialus. Insert the electrode into the cochlea. Continue to advance the electrode array while holding the wing. When the blue marker is positioned at the round window, release the forceps from the wing and remove. To secure the electrode in place, fascia or muscle should be well packed around the round window site. Once the electrode array has been secured at the round window site, the excess electrode lead is coiled inside the mastoid cavity. Use the mastoid cavity bony overhangs to retain the coiled lead in position. The scalp wound is closed and the ultra implant procedure is successfully complete.